Welcome to the A.Little.Mental podcast, the place where you can find credible information, resources, and community to help you reach wellness a little mental at a time. I'm your host and founder, Morgan Reed, and I'm so glad you're here. Let's get into it. One of the most confusing things about finding a therapist is knowing who is actually considered a therapist. They all have these different letters behind their name. Some are considered doctors, others aren't, and it can be a real big challenge trying to figure out who to go to. So today, we are going to get into the major distinctions among therapists based on their degrees. We are going to talk about the difference between licensed versus unlicensed, and we're going to talk about who is able to diagnose you with a mental health disorder and who can prescribe medication. So let's get into it. First, let's dip our toe in a bit and talk about what a therapist actually is. A therapist is anyone who ends up doing some sort of mental health intervention or practicing some sort of mental health intervention. But everyone who works in mental health isn't considered a therapist. So moving forward, I'm going to refer to people who are in the mental health industry as mental health professionals, because that just gives a bigger umbrella term around folks who may or may not practice therapy, but do still work in the industry itself. Okay, so the way I'm going to group these folks is based on their highest earned mental health related degree. So we're going to talk about folks who have medical degrees, doctorate degrees, and master's degrees. And again, I am just going through some of the more popular and more well-known degrees. This by no means is an exhaustive list, but it is something to help you get started. There are a lot of different things that somebody can do under their different degrees, but we're just going to talk about some of the ones most relevant to us. So this is by no means an exhaustive list of their capabilities either. So the first level of mental health professionals that we're going to get into are mental health professionals at the medical degree level. This includes folks like psychiatrists, who are actual medical doctors, and psychiatric nurse practitioners. These folks are usually seen in hospital environments or may have their own practices and can be seen in person or virtually. These are the folks that you would see if you were looking to be diagnosed or prescribe medication, especially if you have a more evolving or complex mental health situation. They evaluate your symptoms, explore medication options with you, and adjust your dosage as needed. These folks also aren't typically the folks who end up doing psychotherapy or talk therapy with you unless they've gotten additional clinical training. Now, as a quick reminder, anyone who has a medical license, like your primary care physician, is able to prescribe you medications, including psychiatric medications. But they aren't specialized in that area, so they still may end up referring you to a psychiatrist or psychiatric nurse practitioner. Okay, so we got through a couple of different types of medical level mental health professionals. Now let's talk about a different type of doctor that you might see, which are psychologists. Licensed psychologists are not medical doctors, but they do have a doctorate degree. Usually it shows up looking like a PhD or a PsyD after their name, but both are considered psychologists. A lot of psychologists end up doing psychotherapy or talk therapy, but a lot of them also end up doing assessments and testing. So again, if you're looking for somebody to give you a diagnosis, a psychologist is a great start in that process. You can typically find a psychologist working in private practice, in a hospital, in group settings, at a school, at a clinic, or really anywhere that you would think you would find a mental health professional. Okay, so we touched on medical degree level mental health professionals. We talked about psychologists, which are doctorate level degree mental health professionals. Now let's get into master's degrees. One type of master's level therapist you may come across are LPCs, or licensed professional counselors. Licensed professional counselors usually emphasize your strengths when it comes to the different sort of therapeutic approaches that they use. You can find LPCs in a lot of the same places you would find a psychologist, especially like community-based settings or clinics. Licensed marriage and family therapists are another type of master's level clinician, and they are very similar to licensed professional counselors in the sense that they can see individuals, but they also specialize in couples and family dynamics. You can also find them in the same place that you would find a psychologist or a licensed professional counselor, like treatment centers. They may have their own private practice, clinics, community centers, things like that. Another type of master's level clinician are LCSWs, or licensed clinical social workers. Licensed clinical social workers also provide psychotherapy, but they also may incorporate additional supportive resources in your community or helping connect you to other sort of services to better progress you on your healing journey. Licensed clinical social workers can be found in outpatient facilities, community clinics, and social welfare organizations. Again, this is not an exhaustive list of all the different sorts of mental health professionals you may encounter in your search, but one of the bigger questions is, how can you tell somebody is qualified or prepared to engage in delivering therapy? So one of the best ways you can determine that is whether they are considered licensed. You probably notice that almost everybody that I said, I used the word license in front of, and that was intentional. Licensed clinicians are like any other sort of licensed professional when it comes to they have fulfilled all the technical requirements that go along with being in their degree. So whether that's the amount of hours they needed, the education, or the particular skill set. And it's because of those standards that I strongly encourage you to always strive to see a licensed professional. Now, there are two exceptions to this, which are student therapists and therapists seeking licensure. Licensed professionals aren't always financially accessible or even physically available. That's why seeing a student therapist or someone pursuing licensure is a solid option. Both of these types of folks are still technically learning, but they are being constantly monitored and supervised by actually licensed professionals. So they're kind of like medical students or residents at a hospital. They are constantly being supervised and they are actively learning and pursuing an advanced degree in the field itself. Now, while some people still might be nervous about seeing somebody who isn't technically licensed, again, seeing a student therapist or somebody pursuing licensure actually has been shown through research to be just as effective as seeing a licensed therapist. Ultimately, the biggest goal is to make sure that you're safe. So, whether somebody claims to be licensed or is claiming to be somebody pursuing licensure, they should, regardless of which one they are, be able to be traced back to an accredited institution or board. The last thing I want to touch on is something that I hit before, but I want to make sure is perfectly clear, and that is who can prescribe medication and diagnose you. The ones who can prescribe medication are, again, psychiatrists and psychiatric nurse practitioners. Anyone with a medical degree can prescribe medication, so any sort of physician also falls into this as well. Licensed physician. Those who can technically diagnose are psychiatrists, psychologists, and the psychiatric nurse practitioners. The rest can technically diagnose because they are trained to do so, but it does vary by state who is actually able to do it. That being said, you don't need a diagnosis to go see a therapist. In fact, there are a lot of different reasons that a therapist may purposefully not diagnose you. Sometimes the stigma of getting diagnosed prevents people from seeking the resources that would actually help them. For others, it may actually impact their insurance. Other times, therapists recognize that clients may hyperfixate or over-identify with their diagnosis. So getting the diagnosis is actually unproductive to their ability to heal and progress through therapy. And finally, sometimes diagnosing someone isn't necessary to help them feel better and isn't really productive to their overall well-being. Diagnosis is not a perfect system. So sometimes just directly addressing what's wrong can help somebody feel better. Okay, so that was a lot of information. Let's run a few things back. First, there are a variety of mental health professionals, but sometimes it's helpful to understand them based on their degree level. Medical degree folks are psychiatrists and psychiatric nurse practitioners. Doctorate level mental health professionals are psychologists. And then master's level mental health professionals can include licensed clinical social workers, licensed professional counselors, or licensed marriage and family therapists. Regardless of who you see, ensure that who you are seeing either has a license or is pursuing licensure through official channels. When it comes to who can prescribe medication, anyone with a medical license has the ability to prescribe you medication, but psychiatric nurse practitioners and psychiatrists are specialized when it comes to psychiatric medication. When it comes to diagnosis, all of these folks technically have the skill set to do so, but it will boil down to the state that you're in around who is allowed to do it for you. Ultimately, seeking medication or diagnosis isn't a requirement to see a therapist. Sometimes your therapist might not even bring either of those things up. Sometimes improving your mental well-being doesn't require those components. And sometimes they can be really helpful. It all depends on what your experience is and what you agree to do with your mental health professional. While knowing the differences in these folks' credentials is helpful, there are still other really important factors that go into who is the best fit therapist for you. And we have other episodes that go into that as well. We also have other resources for you. So whether you are seeking a therapist or want to know what it's like to go in to be in therapy, go online to our website, A.Little.Mental.org, or follow us on Instagram, Facebook, or TikTok at A.Little.Mental. Thanks for listening, and don't forget to be kind to yourself today.